This is Dr. Brenda Slovin from yourmigrainedoctor.com. And today I want to make a video for you that may upset some of you. I've entitled this video, Why Aren't My Migraines Getting Any Better? But before I talk about why your medicine isn't helping to heal your migraines, if we haven't already connected on Facebook, I suggest we do. Please go to facebook.com/yourmigrainedoctor and become a raging fan for lots of up-to-date information on migraines and headaches. And of course, you can always go to my blog at yourmigrainedoctor.com and subscribe to my weekly newsletter. And as a bonus, you will receive my free report entitled, What If It Never Goes Away? So today, to help explain why you're not improving while taking your medication, I'll be highlighting the problem with today's modern medicine. First, I have to let you know I have breaking news for everybody watching this video. I mean, shocking breaking news. Here it is. Ready? The entire concept of modern day medicine is wrong. Shocking, right? Absolutely shocking. How can that be? How is that possible? Well, let me answer that for you. First, the number one problem with medicine is the way that medicine is practiced today. In my opinion, the number one problem with medicine is the first thing that we have to do with medicine is actually name or diagnose the current disease. Then we blame that disease for, of course, every single bit of our misery. And only once it's correctly identified, then we can give medication to kind of squash all those symptoms. Does anybody else find that wrong? I mean, incredibly wrong. What if you don't know what you're suffering from? Or if the medical doctor that's treating you simply can't determine a correct diagnosis? Or what if you're diagnosed differently by every single doctor that you see? Or worse, what if you have 7, 8, 10 different diagnoses? I've had patients with medications that don't help for months on end. They take different medications, hoping each medicine they take, each doctor they see, will start helping them feel better. No, this isn't the way we do things. As human beings, we aren't deficient in medication. We're not. If I'm suffering from depression, I don't have a Prozac deficiency. And guess what? Neither do you. We need to start putting real food, real nutrients back into our bodies. We have to, above all else, feed ourselves, then take the medication if necessary. Another major problem with medicine is that we treat chronic illness like headache, migraine, fibromyalgia, IBS, anxiety, depression, thyroid issues. We treat these issues like they're acute, like they're fresh, like they're brand new. They've just been formed. No, this doesn't work. Current medical practices aim towards acute care, or what you and I would call sick care. Most medical doctors treat the diagnosis and their treatment of the disease like a trauma, which requires urgent medication or urgent attention like appendicitis or a broken bone. Medicine isn't focused on the wellness of the human body. It never has been. And the practice of medicine absolutely is totally incapable of curing a body that's been sick for a long time. There's a drastic, huge, crazy increase in the number of chronic disease diagnoses seen in today's society. Diseases like heart disease, diabetes, mental illness, autoimmune issues, cancers. God, you can't go a single day without hearing that somebody contracted cancer or unfortunately has died from cancer. Try going to a family function. See how long it takes before somebody starts talking about their long battle with whatever condition it is they're dealing with. You can't escape the fact that our society is getting sicker by the second. This current medical model of acute care treatments don't allow the body or the doctor to treat the illness, generally because it doesn't account for the uniqueness of the individual. I mean, outside factors could be playing a role. Environment, this exposes everybody, including you and me, to toxins. And few medical doctors even pay attention to a patient's lifestyle choices. And that also plays a huge role in overall health. That can have a direct influence on the rise in the amount of chronic illness that we see today. And sadly, most doctors are really skilled in the art of dispensing medication, but they're not trained to truly look for the underlying cause of disease. They're not taught to look at treatment strategies like diet, nutrition, exercise. This could help improve illnesses dramatically. This is so unfortunate. Doctors should always be good detectives. Any monkey can read the bolded print on a blood test. It's not hard. The bigger question is, and what every doctor should be asking themselves every single time they read a laboratory test is, how does it fit all together? Doctors always talk about evidence-based medicine, but the true art of medicine is clinical-based medicine. That's the art. That's where the detective work comes in. Blood work offers some really awesome, great, targeted information, but only if your doctor can understand the systems that control that blood result. And be aware, guys, there's lots of drugs, and the drug companies will publish only the studies that benefit them, the ones with good outcomes. You're never going to see the other ones as long as you live. Remember Bextra? Killed a lot of people. So why aren't your migraines getting any better? Well, many reasons. But first and foremost, you have to stop looking at a medicine bottle as the answer. That's the treatment of your symptoms. That's way downstream. The big question is, where or what system has broken down? Where is your body deficient? That's the big question. That's your upstream question. When you can finally get the answer to that question, then you have a chance at real health because it's no longer covering up the symptoms. So you begin to address the issues before they become symptoms. That's how you win. That's the whole purpose behind the way I practice. That's functional medicine. That's systems medicine. That's personalized medicine. That's personalized treatment. Eventually, I hope the medical community, they'll get it. Eventually, they'll catch up. But do you really want to wait until they do? Can you wait until they do? I wish you a pain-free life filled with health and abundance. Again, I'm Dr. Brenda Slovin from yourmigrainedoctor.com, and I will see you in my next video. And by the way, if you have any questions that you would like to ask me, send me a message via email or Facebook. You can send it to drslovin@yourmigrainedoctor.com. And of course, go ahead and right at the bottom of this post, you can post whatever questions that you have. I would love to hear from you, what you think of this video, as well as what you've tried and what you found that's worked. I'm really good at responding, so any questions that you have, feel free to ask me. I look forward to seeing you in my next video. Until then, bye-bye.